I want to talk a minute about regenerative medicine. Now, what is regenerative medicine? You might have heard the term regenerative medicine. Well, simply enough, regeneration is the opposite of degeneration. So when you have an injury, when you're young, maybe you have an injury, as you age, if that injury doesn't get rehabbed properly, or perhaps there's just so much damage that it got rehabbed as good as it could get, but over time, you get wear and tear. And over time, what can happen is your joint can go through a process of degeneration or breaking down. All right. Now, I'll talk about orthopedics because that's primarily what we do, joint degeneration. And our number one spot that we do is knees. We also do quite a few spines, shoulders next on the list, and then a smattering of elbows, wrists, ankles, and other areas. The truth is we can work on regenerating any joint. So it's a science or study of how do we do this? So there's two big categories that we utilize to do this. Now, the first one is PRP. Now, what is PRP? PRP stands for platelet-rich plasma. Now, platelet-rich plasma is where we take a patient's blood, we can spin it in a centrifuge, and we pull out the platelets in the plasma. Those are the major healing parts of your blood. We can put that into a joint, and what that does, it starts an inflammatory cascade, and that inflammation signals to your body that it needs to harvest resources from your body and go to that area to promote healing. And sometimes that can stop the degeneration where it's at and actually work on generating some new tissue in there. Now, what we found, now we've been doing regenerative medicine now for 3 years, and what we found is we got some limited results with the PRP. It can work pretty well in some younger people because they have a lot more healing factors. Unfortunately, many of the time people that come in are older, and it makes sense because it takes time to degenerate. And with the older patients, we found that the best approach and where we were getting the really, really robust and very good outcomes, actually generating new tissue, was with the stem cell product. Now, when people talk about stem cells, what are stem cells? We might have heard it on our favorite podcast, stem cells, or perhaps you go to Mexico or you go to Colombia and you're gonna get stem cells. Well, when we talk about stem cells, what we're talking about is human cellular tissue product. It's basically, there's 3 places that you can get stem cells. Now, you can get stem cells from belly fat, or you can harvest it from your bone marrow. The only problem with getting it from belly fat or bone marrow is that if you're 50, so are your stem cells. And they can also be painful to harvest. You can imagine drilling into your bone marrow to try to get some stem cells out. So the third place that you can get stem cells, and where most of the clinics in the world get stem cells, is from umbilical cord tissue. These umbilical cords are from live births, donated tissue. In our clinic, we use a lab that we're allowed to purchase these cells from. And so it's a part of the umbilical cord called Wharton's jelly. Now, Wharton's jelly doesn't just have stem cells. There are stem cells there, but it also has other cytokines, growth factors, exosomes, other things that help regeneration. So we use that product, we combine that with exosomes. Now, exosomes are not cellular tissue. We do have nucleated stem cells that we put in there, but we also have these exosomes that are not cells, but they help coordinate the cells. So we get a magnifying effect when we combine the stem cells with the exosomes, and we get these really great outcomes. And so, there's so much misinformation about this, unfortunately. I've been in this now for 3 years, and the longer I'm in it, the more crazy stories I hear of all sorts of clinics making claims or doing something, and it's actually not what the patients are paying for, which is sad. But when you get the real stuff, we're seeing some really cool stories. And I've shared the stories. If you find another video of me, I have some videos where I either have patients talking about their own cases or I talk about some cases. And it's real fun. It's been a really nice adventure to go down this path and really be able to help people in a way that I wasn't able to before. So, some education, hope it helps.